Imagine a major pandemic started to spread throughout the world. There was no antibiotic, no cure for this disease. People around the world are scared for their lives. At first, they turn to homemade remedies to try and keep themselves safe. But when none of these work, they start to get very desperate. They turn to talismans, magic spells, but nothing keeps them safe. This is very similar to what happened when the Black Death, the bubonic plague, infected people in the 12th century. The government had no plans to contain this disease. This is why the Black Death is an important event. After the very high death toll, containment of disease and limiting its spread was more advanced than before. People took strong action after the plague to prevent it from happening again. After the Black Death, the people invented quarantine practices, which have the very strong capability to reduce the likelihood and impact of future pandemics that went on through the cities. The first precursor to the Black Death was the deplorable hygiene conditions that the people lived in. Excrement lined the gutters that could be seen from the street. When trade workers had rubbish, they could simply have dumped it right onto the streets. The River Thames constantly had trash flowing through its river. Authorities tried to implement regulations, but those regulations were largely ignored. All of this made a nice home for the rats in the city. And when trade increased in the city of London, so did the trash that the rats could eat. This is important because rats are one of the main vectors for the Black Death to spread. And with so many of them living so easily amongst the people, it was easy for them to spread the bubonic plague. The second precursor to the Black Death was Yersinia pestis. It is the bacteria that causes the bubonic plague. It lives inside of fleas. It multiplies inside its host, which blocks the flea's stomach and makes them hungry. When they feed, they spit the bacteria of Yersinia pestis onto the wound, and they spread the disease. The fleas that Yersinia pestis lived inside were capable of living after infecting one person. One flea could infect multiple people or mammals. The fleas were able to transfer the disease very easily, living off of the many rats that were inside medieval Europe. The Black Death first reached Messina, Italy, on October 1347. This is where the plague started its spread in Europe. It was, and still is today, an active harbor in the city. Instead of relying on food, the town of Messina was reliant on trade with other countries. One day, trade boats arrived, and they had many people on board who were either sick or dying. Although these ships were later expelled from the port, the spread of the bubonic plague had already begun through the city. This is how the plague was introduced to the city and the rest of Europe. The people of Messina panicked when they saw it, and they unintentionally spread the plague, trying to run away from it. The ships that were rejected from the port went on to other cities and continued to spread the plague. Then the Black Death spread into London. During medieval times, London had very poor hygiene. The tradesmen that worked in the city would simply dump their rubbish onto the streets. Despite health officials trying to impose laws to limit this sort of thing from happening, they were largely ignored. This allowed the plague to spread through the city. London was also home to a port on the River Thames. This port not only shipped goods, but also rats and people that were infected with the bubonic plague. This is one of the ways that much of Europe got infected. Trade routes bringing it in and taking it to other cities. The Black Death also hit Ireland very hard. It came to those lands, but didn't spread as much as it did in Europe. It hit the settlements of the Anglo-Irish very hard since they lived very close together and near the ports. But the Gaelic Irish, who were living much higher on the hilltops, and with their housing more spread out, they weren't as affected as much as the Anglo-Irish. People could also see that along the highways, the farther out you got and the more spread out a community was, the less the bubonic plague had an effect on the people. Even so, the people of Ireland were very scared of the plague. Some people were not even willing to visit their loved ones who were sick, in fear of contracting the plague themselves. Sometimes they would be left alone to deal with the plague by themselves. The first solution to the Black Death was lazarettos, islands of quarantine. These were places that those suspected of having the plague were sent to. They were to remain on these lazarettos for 30 to 40 days, and then they would be free to leave if the officials allowed it. Though many people feared those who were initially healthy would get sick inside of them, it was some form of method of containment, and it would be improved much later on. The second solution to the Black Death was quarantine. Around popular docks, quarantines were set up. The captains of ships would have to convince the officers that their cargo and their men were clean. If the officer was suspicious, he would send them to quarantine zones to have them checked and their cargo cleaned out. This helped them limit the spread of diseases. There was also another disease that changed how people handled them. It happened from 1917 to 1919, the Spanish influenza. Once again, there was no known cure for the Spanish influenza. The practice of quarantine was there, but just how prepared was the US for an influenza pandemic? This would be tested during the time the Spanish influenza struck. There was no cure for the Spanish influenza. The second subject will go over why non-pharmaceutical interventions can save lives, even if a cure is not available. The first precursor to the Spanish influenza was lack of proper action taken by the officials. A prime example being Wilmer Cruson allowing the Liberty Day Loan Parade to commence. Hundreds of people got sick just days afterwards. The second precursor was the people not listening to the health officials. People flocked to the schools just before they were closed to finish projects. Some people, on learning the theaters would close, tried to pack in for the last few performances that they could see before the shutdowns. Haskell County had its first cases of Spanish influenza. Soldiers from Camp Funston would go to the city on leave. In March 4th, the first cases of influenza were reported in the camp. It spread quickly among the soldiers. Soldiers went in and out of the camp to places around the U.S., spreading the disease wherever they went. Camp Denver was a second vector for the Spanish influenza. Though doctors were sent into the camp and made recommendations to contain the flu, these were not effective, and people still moved in and out, and they spread the disease. It spread to the other camps and eventually to other cities. The people of Philadelphia were hit hard by the flu. People were told false information, like the cause of the flu being falsely identified, and that it would only affect soldiers. The Fourth Liberty Loan Parade was asked to be canceled by concerned physicians who were concerned about the flu, though these were largely ignored in favor of raising money. Hundreds of people were admitted into the hospitals just days after the parade. The first solution to the Spanish influenza was the closure of schools. The idea behind it was called social distancing, limiting contact with others to limit the spread of the disease. St. Louis had one of the lowest death rates of major cities during the pandemic. Belleville, also in Illinois, did not practice quarantine and had one of the highest death rates in the state. The second solution to the Spanish influenza was the closure of places of entertainment. There were high death rates in the state of Minneapolis. Dr. Guilford believed closing down places of entertainment would lower the death rates. When this happened, the number of new cases declined just 10 days later. However, they spiked right back up when those places were reopened, and they were once again shut down. After the Spanish influenza, people could really see the value in quarantine. The Spanish influenza is known as one of the highlights of the usefulness of quarantine, with Minneapolis being a prime example of its effectiveness. Quarantine stations are now placed around the U.S. that check cargo from other areas to limit the possibility of the spread of disease. People are also checked if they are ill and are set aside to make sure that they don't spread the disease. Though the tragedies of the Spanish influenza are clear, it is a great lesson to people on how effective non-pharmaceutical interventions, or NPIs, are in saving people's lives.